Which of the following is not part of a safe system of work? A. Construction phase plan. B. Health and safety policy. C. Permit to work. D. Professional trust. Correct answer, D. Professional trust. Work with which of the following materials may require a COSHH assessment? A. Asbestos. B. Metal. C. Plastic. D. Tile. E. Wood. Correct answer, A. Asbestos. D. Tile. E. Wood. You cut your hand whilst having lunch on site. What should you do? A. Report it and seek medical treatment if required. B. Seek medical treatment, but do not report it. C. Treat it yourself and carry on, it is not severe enough to affect your ability to work. D. Treat it yourself and carry on, only accidents happening during work need to be reported. Correct answer, A. Report it and seek medical treatment if required. Which of the following best describes a respiratory sensitizer? A. It is a kind of hazardous dust fume. B. It is a piece of respiratory protective equipment. C. It is a prescription device for patients suffering from respiratory disease. D. It is the person in charge of protecting respiratory health. Correct answer, A. It is a kind of hazardous dust fume. What are two things you must do to avoid an extension reel overheating when in use? A. Do not overload it. B. Ensure it is at maximum capacity. C. Ensure it is near a fan. D. Unwind it fully. E. Wind it tightly. Correct answer, A. Do not overload it, D. Unwind it fully. How often does the Health and Safety Executive, HSE, recommend testing equipment, tools, and leads? A. At the start of every project. B. Once a week. C. Once a year. D. Once every 3 months. Correct answer, D. Once every 3 months. Hearing loss as a result of noise exposure sets in. A. Immediately. B. Never. C. Only when a person has pre-existing ear problems. D. Over a period of time. Correct answer, D. Over a period of time. You were told in a briefing that an area requires hearing protection, but when you arrive there is no signage. What should you do? A. Continue without protection. B. Continue without protection if the noise in the area is tolerable. C. Wear the protection you were instructed to. D. Wear the protection you were instructed to in your briefing, and report the lack of signage to your supervisor. Correct answer, D. Wear the protection you were instructed to in your briefing and report the lack of signage to your supervisor. What TWO steps can you take to limit the risk of developing HAVS when using handheld tools? A. Exercise your hands during break periods. B. Relax your grip so that most of the work is done by the tool. C. Rest your hands during break periods. D. Tighten your grip to reduce the strength of vibration. Correct answer, A. Exercise your hands during break periods. B. Relax your grip so that most of the work is done by the tool. What hazard is created by too much oxygen in the air? A. Breathing becomes more difficult. B. Fumes can become more noxious. C. Injuries are more easily sustained. D. Items become more flammable. Correct answer, D. Items become more flammable. With a mobile access tower, why is it dangerous to install the platform too high? A. Because equipment will be at greater risk of falling. B. Because the guardrails will not provide adequate protection. C. Because this increases the harm from falling. D. Because this makes the structure less stable. Correct answer, B. Because the guardrails will not provide adequate protection. When dealing with chemicals, the gloves you wear must be A. Impervious. B. Thick. C. Tightly sealed around the wrist. D. Waterproof. Correct answer, A. Impervious. Which filter grading offers the highest protection? A. FFP1. B. FFP2. C. FFP3. D. FFP4. Correct answer, C. FFP3. Asbestos most commonly comes in 3 types. What types are these? A. Blue, brown, and white. B. Blue, white, and yellow. C. Brown, white, and black. D. White, black, and grey. Correct answer, A. Blue, brown, and white. Wellington boots are a safe way of protecting your skin from burns. This applies to which activity? A. Laying down wet concrete. B. Sewage works. C. Using lead paint. D. Welding. Correct answer, A. Laying down wet concrete. You have a half-finished container of a hazardous substance and no clear procedure has been defined for disposing of it. What should you do? A. Ask your supervisor or site manager what the safe procedure should be. B. Dispose of it along with general waste where no procedure has been specified. C. Leave it in a safe place to be disposed of later. D. Pour the remainder down the drain. Correct answer, A. Ask your supervisor or site manager what the safe procedure should be. Why is it important to know your limitations? A. Because pushing past them may adversely impact your mental health. B. Because this will identify areas you need to push yourself harder in. C. Because you will need this information for performance reviews. D. It is not important. Correct answer, A. Because pushing past them may adversely impact your mental health. How might your employer reduce the impact of a physically stressful task? A. Increase the hourly wage for this task. B. Make shifts longer to get it done as soon as possible. C. Put workers on rotation. D. Select the employee who is least likely to suffer physical stress. Correct answer, C. Put workers on rotation. You are asked to help out on a team lifting. What TWO conditions must apply for you to accept? A. You must be of a similar stature to the rest of the team. B. You must be on a break. C. You must be stronger than the rest of the team. D. You must be trained in team lifting. E. You must be wearing PPE. Correct answer, A. You must be of a similar stature to the rest of the team. D. You must be trained in team lifting. Which of the following is advisable when lifting a heavy material? A. Your arms and biceps should be doing most of the work. B. Your back should be doing most of the work. C. Your legs and thighs should be doing most of the work. Correct answer, C. Your legs and thighs should be doing most of the work. What kind of sign is a white drawing on a red square? A. Firefighting sign. B. Hazard sign. C. Prohibition sign. D. Warning sign. Correct answer, A. Firefighting sign. What does a prohibition sign look like? A. A red circle with a diagonal red cross through it. B. A red circle with a single diagonal line through it. C. A red circle with a white drawing. D. A triangular sign with a red border. Correct answer, B. A red circle with a single diagonal line through it. Which safety sign should you see on the bottle of a flammable liquid? A. B. C. D. Correct answer, A. What sign may you find, accompanied by explanatory text, where asbestos removal is taking place? A, B, C, D. Correct answer, A. Who is at risk when vehicles and mobile plants are being moved? A, all of the above. B, nearby workers. C, operators. D, passers-by. Correct answer, A. All of the above. 26. How often should equipment used for lifting people be thoroughly examined? A, annually. B, every 6 months. C, every 2 years. D, only when used for the first time. Correct answer, B. Every 6 months. You spot something on site you think might be an unmarked hazard, but you are not sure and you are busy. What should you do? A, nothing. If it were in fact a hazard, it would have been marked. B, report it immediately. C, wait for a spare moment, then go and assess the risk. D, wait to see if it develops into a clear hazard, then report it. Correct answer, B. Report it immediately. Which of the below is not required at site induction? A, information about how you will be consulted on matters of health and safety. B, information about site traffic management. C, information about welfare facilities. D, these should all be included in a site induction. Correct answer, D. These should all be included in a site induction. If an employee suffers serious injury and is unable to perform in their role for 7 more consecutive days, who must be informed? A, the Health and Safety Executive, HSE. B, the Board of Directors. C, the recruitment team. D, the site manager. Correct answer, A, the Health and Safety Executive, HSE. What is the main reason that respiratory hazards are so dangerous? A, you may choke from blocked airways. B, you may contract a range of illnesses. C, you may find it harder to communicate. D, you may lose the ability to talk. Correct answer, B. You may contract a range of illnesses. Which of the following is true about carbon monoxide? A, it is a common byproduct on construction sites. It is harmful in high concentrations. B, it is a common byproduct on construction sites. It is not dangerous. C, it is a rare byproduct on construction sites. It is highly dangerous in any concentration. D, you will not find carbon monoxide on construction sites. Correct answer, A. It is a common byproduct on construction sites. It is harmful in high concentrations. How can you adapt a dust mask to make it suitable for protecting against hazardous fumes? A. A dust mask is already suitable for protecting against hazardous fumes. B. Dampen the mask with water. C. This is not possible. D. Wear two dust masks. Correct answer, C. This is not possible. Where should you store petrol for refueling tools? A. At the site office. B. At the welfare services. C. Away from where the work is being done. D. Where the work is being done. Correct answer, C. Away from where the work is being done. You were told in a briefing that an area requires hearing protection, but when you arrive there is no signage. What should you do? A. Continue without protection. B. Continue without protection if the noise in the area is tolerable. C. Wear the protection you were instructed to. D. Wear the protection you were instructed to in your briefing and report the lack of signage to your supervisor. Correct answer, D. Wear the protection you were instructed to in your briefing and report the lack of signage to your supervisor. If you cannot find an appropriate place to refuel, what TWO measures must be in place when you refill? A. You must be no closer than 10 meters from drains or watercourses. B. You must catch any spillages by laying an absorbent mat or drip tray underneath. C. You must cordon off the area. D. You must keep a record of the incident. E. You must use a leak-proof siphon. Correct answer, A. You must be no closer than 10 meters from drains or watercourses. B. You must catch any spillages by laying an absorbent mat or drip tray underneath. Which or any of the following may cause low levels of oxygen in an enclosed tank? A. Atmospheric pressure. B. Convex walls. C. Moss and algae. D. Rust. Correct answer, D. Rust. How can you find out a scaffold platform's safe load rating? A. You can check the signage or handover certificate. B. You can check with the contractor. C. You can inspect the scaffolding for damage. D. You can refer to the safe system of work. Correct answer, A. You can check the signage or handover certificate. Which of the following will conduct electricity if it touches or comes close to a power line? A. Crane. B. Long metal ladder. C. Piece of scaffolding. D. Power lines do not conduct electricity to the ground, as they are safely insulated. Correct answer, A. Crane, B. Long metal ladder, C. Piece of scaffolding. The fresh air pump in your excavation stops working. What should you do? A. Only remain in the excavation for short periods of time so the air can replenish. B. Report this to the site manager but continue working if the risk seems low. C. Source suitable RPE and continue working. D. Stop work and report the broken pump so it can be repaired. Correct answer, D. Stop work and report the broken pump so it can be repaired. Many safety signs are likely to indicate areas where you must wear PPE. Which of the following signs is least likely to indicate a situation requiring PPE? A. B. C. D. Correct answer, B. If working alone, what is any extra provision you may be asked to make? A. Always keep a fire extinguisher to hand. B. Keep detailed personal notes of your activities. C. Keep in regular remote contact with your supervisor, e.g. through radio. D. Wear a body cam. Correct answer, C. Keep in regular remote contact with your supervisor, e.g. through radio. Which fire extinguisher should be used when conducting hot works? A. Never use a fire extinguisher on hot works. B. One designated for your team and stored at a safe distance from the work area. C. One specifically designated to your work area and task. D. The nearest one available in case of emergency. Correct answer, C. One specifically designated to your work area and task. Which of the following is not an example of an on-site emergency? A. Chemical spill. B. Fuel shortage. C. Significant chemical burns. D. Workers trapped in a collapsed excavation. Correct answer, B. Fuel shortage. After cutting your finger on site, you find there are no dressings in the first aid kit. What should you do? A. Inform the person who manages the kit. B. Nothing, the person in charge of managing it will be aware. C. Report it in the accident book. D. Restock the kit at the next opportunity. Correct answer, A. Inform the person who manages the kit. Your colleague reports they have a pizza knee. What does this mean? A. Pizza knee describes a buildup of fatty tissue around the knee. B. Pizza knee describes irritant contact dermatitis on the knee. C. Pizza knee describes patchy discoloration on the knee from kneeling too long. D. Pizza knee is when a knee has been heavily bruised. Correct answer, B. Pizza knee describes irritant contact dermatitis on the knee. What is good practice when it comes to discussing how you are feeling? A. Do it rarely, and do not bother people. B. Find a loved one, a trusted friend, an independent party, or a professional that you can do this with. C. Identify the problem before talking about it with somebody. D. Only discuss matters with a trained professional. Correct answer, B. Find a loved one, a trusted friend, an independent party, or a professional that you can do this with. What is the best way to manage mental health issues at work? A. Discuss them in confidence with a supervisor or manager. B. Do not seek support from your employer, as you may lose your job. C. Find a different job. D. Self-medicate. Correct answer, A. Discuss them in confidence with a supervisor or manager. You will be lifting a heavy load. Who must help plan out a safe system of work? A. All workers in the area. B. The health and safety executive. C. You. D. Your supervisor. Correct answer, C. You. D. Your supervisor. What does this sign indicate? A. Environmentally hazardous substance. B. Hazardous chemical spill in area. C. Poisonous wildlife in area. D. Protected wildlife in area. Correct answer, A. Environmentally hazardous substance. What is the hand signal for danger? A. Two fists raised above your head. B. Two hands raised to your mouth. C. Two open palm hands raised directly up. D. Two open palm hands waved above your head. Correct answer, C. Two open palm hands raised directly up.